Bladder symptoms with endometriosis can be super complicated because there's a difference between bladder involvement with endometriosis and urinary involvement of endometriosis. And the symptoms can look a lot like IC, interstitial cystitis, which a person with endometriosis could truly also have that as a comorbidity, complicating it even further. And to take it even a step more than that, the symptoms can also present a lot like UTIs, a urinary tract infection. But the thing is, with UTIs in endometriosis, the prevalence is really, really low. It's like 1 to 5% of cases that actually have urinary tract involvement. So that's interesting. But to a person who doesn't exactly know what they're dealing with based on the symptoms they're experiencing, because the symptoms can be so, can mean so many different things, you might say, I'm just dealing with UTIs. And meanwhile, you have no idea that you actually are dealing with endometriosis. And it's so frustrating because endometriosis is so commonly dismissed, just entirely dismissed, misdiagnosed, and gaslit. And that's actually really scary for some people, because in the case of ureter involvement, for example, if there's endometriosis located on near the ureters, that can actually cause kidney failure. And what's really awful is that if you ended up in the hospital with kidney failure, the likelihood of them investigating what the root cause of that kidney failure is and actually determining that it's endometriosis or referring you out to investigate that, the likelihood of that happening is really, really minimal. And what's awful about that is that, until the actual root cause being endometriosis in that case causing the kidney failure, until the endometriosis is actually addressed, you're just going to be chasing dealing with that. You're going to be chasing dealing with that symptom, that kidney failure symptom. I'm going to call it a symptom. That's not the right word. I can't think straight right now. You get what I'm trying to say. And so that's what makes it so scary to me that that doctors aren't asking more questions. Because endometriosis is a whole body disease from head to toe. And sometimes you're not really going to experience any symptoms, or the only symptom could be infertility. And you're not going to know that until you actually start to try to conceive, right? But all of these awful things can be going on inside of your body that can cause havoc. And if somebody stopped and listened and said, wait, you just said XYZ happens and XYZ happens, and wait, we need to start asking more questions.